Hi, this is Dr. Ty Vincent again, talking about the coronavirus outbreak and some of the problems people are running into with that in terms of the critical care medicine aspect of this. So not those of you who are mildly sick at home aren't going to run into this, but the issue they're running into at medical facilities and intensive care units with everybody needing a ventilator and being critically ill and some people dying despite everything you try to do for them. I'm going to discuss this topic in a way that hasn't been discussed so far. I know there's a popular video circulating now that I've seen with ICU doctors, one in particular talking about how this is not a pneumonia that you're treating. It's more like respiratory distress syndrome, honestly, ARDS. And it's more akin to being at high altitude or some problem like that regarding the physics of it, right? Which is true. So treating it like it's pneumonia, pounding people with antibiotics and just giving them supplemental oxygen doesn't work in that setting. But it's not really like high altitude either. It's more analogous to drowning, let's say. Like your lungs are pumping and working, but there's no oxygen to be had. And the real problem isn't analogous to either drowning nor high altitude. The problem is ARDS. I mean, that is its own thing and it's its own physiology. As a disclaimer, I myself no longer manage ICU patients. I did in training and I did in practice for a time, but it's been 13 years since I ran a ventilator on anybody. Just full transparency here. I'm an outpatient doctor now, family medicine trained, but my major field of expertise in the last decade and my exclusive practice in the last few years has been immunological disorders, dealing with inflammatory conditions in people on a chronic basis, autoimmune diseases, allergies, chronic inflammatory syndromes, things like that. So my understanding of immune response problems runs deep. This is what I deal with every day. And what they're seeing with these patients that have severe respiratory distress problems following COVID-19 infection, which can also happen after influenza, can happen after a lot of different types of respiratory things that start the inflammatory process, is that the problem is really the interaction between the person and the virus or infectious agent. Infection is always a balance between those two things. It's the thing you're reacting to and it's the way you react against it. Okay? So in acute respiratory distress syndrome, the problem is really the person's immune response to the agent. And this is why you see such tremendous variability in illness among different people. Half of people might be completely asymptomatic is what they're determining, which is normal when you're looking at coronaviruses, rhinoviruses in general. The other half will be sick to some extent. And then within that sick to some extent category, there's this huge spectrum of illness too. You can have what seems like a bad cold for a week and be at home and kind of miserable, go through a box of Kleenex and then life goes on, or you can die. Despite every medical intervention in the book, you might die. And just because you're over 70 doesn't mean you're going to have the lethal illness, right? Just because you're young doesn't mean you're going to have a mild illness. So what explains this diversity is the human immune response to the antigen, in this case the virus. And that human immune response, once it kicks off and starts to cascade with all of the cytokine storm you read about and the cellular activities and the tissue responses, once that sets off and takes place, the virus itself is now irrelevant. Even if you had an effective antiviral drug to take, at that point in time, it wouldn't do anything to benefit you because you're no longer dealing with the virus. Like the doctors in the ICU have said, well, this isn't a viral infection. Well, it was, and now it's not. Think of it like allergy. So if I eat peanuts, I'm pretty much fine. I have a very minor reaction, like I'll clear my throat for an hour after I eat peanuts because I have this really minor kind of sensitivity. But some of you out there, if you eat a peanut, you'll die. Right? Or if you even smell peanut butter from 10 feet away, your eyes might burn or your face might itch or you might break out in hives. That's why peanuts are like such a big thing. Peanuts are, for some reason we don't understand, more highly allergenic and immune reactive just inherently than most other kinds of foods. But there's nothing inherently harmful or lethal about a peanut. It's all about how your immune system reacts to it. And with this virus and other infectious conditions, really, how you react to it immunologically is what determines how sick you're going to be and if you're going to be sick at all. And that's the thing that they need to understand because that's really the focus of where treatment needs to be, is that person's immune response, how to deal with the inflammatory milieu in the lung tissue. Because what happens when people get acute respiratory distress syndrome like this, ARDS, is that the lung tissues themselves thicken. They fill with fluid, they get edema. So that's why I equate it more to drowning than high altitude. Because the lung tissue itself thickens and fills with fluid so that the oxygen can't pass through that distance. So instead of making a cloth mask to walk around the neighborhood, right, you can still breathe through a millimeter of cotton. It's different, but you can breathe through it. Try breathing through a pillow, right? You can kill people with pillows. See it in the movies all the time. So that's the problem with ARDS, is that your lung tissue turns into a pillow instead of a t-shirt. And you can't breathe through that. And you can't mechanically ventilate through that either. So the problem is the lung tissue and the immune response occurring within. So the other natural interventions I talked about in some other videos, like intravenous vitamin C at high dose, directly addresses that oxidative stress, inflammatory response, what's going on in the lung tissue. The one case I mentioned in that video was exactly a case of ARDS following respiratory infection, and the person was literally dying. They had gone off the ventilator and gone on to ECMO, whereas you use a machine to put oxygen into your bloodstream for you because your lungs can't do it. That's exactly what they're running into now. And that person recovered completely and fully and with no sequelae. The other thing is N-acetylcysteine that I mentioned in that video. Those are two things that could be critical care interventions. If any critical care doctors are out there and happen to watch this video, look into using those things in the ICU setting today for these people, because what have you got to lose, right? They're harmless, they're cheap, and if everything else has failed, that's the mother of invention, right? You might save some lives. But prior to that, making yourself as healthy as possible so that your immune system doesn't go berserk over what should be a minor viral illness is the thing that you can do day to day. Just, try to be healthy, whatever that means, right? Don't live on pizza and beer and ice cream while you're on quarantine. Eat healthy food as much as you possibly can. Real food that doesn't have a label on it and a list of ingredients, right? If you can, that's better. Try to be healthy and happy and positive from a spiritual and emotional standpoint, because being super stressed will also weaken your immune system and also lead to a more hyperreactive immune system. A lot of the patients that I work with today who have inflammatory conditions, autoimmune diseases, they developed them after a period of intense stress. So this self-imposed quarantining or this government-imposed quarantining and the conditions we're all living under right now, all the financial insecurity and everything, isn't helping that particular aspect of human health. We know that. It's just kind of a necessity right now. But so those are the things you can do on your end. Then some of the supplements I talked about and other people throw out around there to improve general immune function might do some good too at preventing this from getting out of hand in your case. But basically, I just wanted people to understand a little bit better probably what's going on with the pathophysiology in the lungs of these people. And some of the doctors out there who are telling you what they're experiencing, they're right. It's not the virus that is the problem. It's how the person reacts to the virus that's the real problem. And it's not a bacterial pneumonia that's the problem either, because those are fairly easy to treat. Antibiotics and assistive support with the ventilator until you recover from using the antibiotics and things like that. It's not that. And that's part of the reason why you're seeing middle-aged people, men like me in their 40s, dying from this occasionally. It's not because they even have underlying illnesses or their immune system is weak or anything. It's that the human immune system today, in a very general sense, for a large percentage of the population, is poised to be hyper-reactive to things. Just like we've seen this massive increase in allergies, asthma, autoimmune diseases of every variety in our culture in the last 20 to 30 years. So you're going to see more people responding like that to a virus like this that 50 years ago might not have had this kind of incidence of reactivity, but it does today. So food for thought, maybe some useful information for somebody out there. Just try to stay healthy and away from sick people and ride it out. Thanks.